Hello everyone, my name is Omolara and I welcome you to the official eDokita YouTube channel where we aim to keep you informed and help you make better healthy choices. On today's episode of What's Next, let's talk about the Hepatitis B virus infection. The hepatitis B virus infection is a potentially dangerous infection of the liver that can be easily preventable with vaccination. Now, common routes of spread will include use of blood and blood products. In this case, we'll talk about sharing sharp objects and being transfused with unscreened blood, saliva, sex, which could be vaginal, anal, or oral, and then sweat from an infected person to an uninfected person, and finally vertical transmission from mother to child, which could occur during pregnancy, during labor, or during nursing. Now, if an individual tests positive for hepatitis B virus, there are other tests that will be required, including checking if the infection is a current one or it is a chronic one, which means it has lasted for several weeks into months and possibly into years. Treatment for hepatitis B virus include drugs. Now, these drugs are not basically to cure hepatitis B virus because there is no cure for hepatitis B virus. But the hepatitis B virus can be managed, and these drugs helps to reduce the viral load and to reduce the progression of this condition into chronic situations like chronic liver disease, even cancers, which will eventually require a liver transplant. Also, lifestyle modification to avoid alcohol is necessary. Finally, for pregnant women, when they start their antenatal care, one of the investigations that is required of them is hepatitis B surface antigen and anti-hepatitis C virus. If the mother tests positive for this, they are further cancelled. So they are being managed conservatively by the gynecologist and a gastroenterologist. During antenatal care, mothers are advised on the need to give their child or children, considering that we could have cases of multiple gestation, immunoglobulin of hepatitis B, in addition to the usual hepatitis B virus vaccination that they get at birth. Now, this vaccine is very expensive, so mothers are pre-warned, pre-cancelled on the need to make money available because their child or children would have to be given this immunoglobulin within the first 72 hours of life. I hope that we've been able to help you recognize that hepatitis B virus, though potentially deadly, is not the end of life. Don't forget to subscribe to our YouTube channel and our other social media handles on Facebook, Instagram, and Twitter on @eDokitaHealth. We promise to bring you more juicy tips in days to come. See you next time. Bye.